Live from Ave Maria, Florida. This is Dr. Raul Enad from Cadenza Medical Clinic. Do you know that green is very important, just like as green as St. Patrick's Day? And in that notion, green is very important for the microbiome, which is the king of the body. Microbiome dictates your health. Microbiome needs the greens that we need to consume. And I'm going to emphasize that the prevalence of early onset colon cancer is not from any food, but actually it's in the absence of fiber. That the absence of fiber, which is depriving the body or the colon of the important substances to protect the colon to prevent having colon cancer. So that is the premise. If you like this topic, please hit the like button and stay until the end of the video because we will have a lot of discussions to do. So as I said, green. Really, it's not just about green. It's the fiber of the green. But because it's St. Patrick's Day, we respect the green. The center of the attention is microbiome, or what you call microbiota. There are trillions of them. Trillions, mainly two genera, Lactobacillus and Bifidobacterium. So let's focus on Lactobacillus genera, and we're familiar with many of these, or few. Lactobacillus rotari, which we identified already, that had been studied a lot in terms of improving the systemic diseases like autoimmune disease, psoriasis, rheumatoid arthritis, even with GI symptoms like acute diarrhea, constipation, especially the constipation side, and even infantile colic is also benefited from this bacteria. Moving on, Lactobacillus gasseri, which is a very popular microbiome, well known for its effect on metabolism. So I'm going to explain to you why these bacteria affects these things. So let's talk about the microbiome. Where are they dwelling in our body? Turns out it's in the second portion of the small intestine called the jejunum, or the small intestine, so that we don't want the small bacteria, the good bacteria, to be overwhelmed by bad bacteria, which is from the large intestine, generally known as the enteric organisms, represented by E. coli, Klebsiella, Pseudomonas, that can affect you. E. coli, for example, can give you the revenge of Montezuma, the diarrhea when you go to Mexico, for example, or when you have spoiled food, especially cooked rice that is put in room temperature, and it gives you Bacillus cereus. Violently gives you diarrhea, vomiting. It's a board exam question. And E. coli, enteric toxigenic E. coli example. The problem with E. coli is this. E. coli promotes the production of colectin in the cells of the colon. This colectin then promotes mutation of the cell of the colon, individual cell of the colon. This mutation promotes the formation of cancer cells called colon cancer. It used to be that colon cancer onset is about 50 years old. That's why the screening time is usually about when you reach 50 years old. That is not the case anymore. This disease entity that's already very prevalent, and actually it was reported in The Economist about 6 months ago, they call it early onset colon cancer. It is because of the absence of fiber. Why the fiber? Why the greens? The greens, or the fiber, is fermented by the bacteria to produce butyrate, acetate, and propionate. Let's deal with these different they're called short chain fatty acids. The butyrate, the main role is it is the colonocyte fuel, or the cell of the colon. The key benefits: it promotes gut barrier. Most of my patients already know about this, that the gut or the intestine is supplied with mucin layer that protects the gut from having entry of this foreign body to your animal, to the blood kingdom or the lymphocytes, because the lymphocytes would promote antibodies against these proteins, for example, against gluten, for example, or gliadin, where the antibody is formed and the antigen antibody precipitates, homes into the cells of the intestine, to the celiac, for example, and eventually will produce celiac disease. It is a long history of inflammation that manifests late in life as bleeding, lower GI bleeding. That is because of the denudation of the blood of the lining, inflammation in the colon, or colitis, that promotes this shedding of blood. Long latency, such that there's a pyramid at the base. At 10, 20, 30, you don't really much have symptoms. And then later in life, 50, 60, then you develop the full-blown celiac disease. So you don't want that to happen to you. Usually, first decades, it would manifest with non-specific GI symptom, or what you call dyspepsia, primarily with bloating, acid symptoms sometimes, constipation primarily. That's why it's illegal to have constipation in my practice. You have to move your bowels regularly, at least twice a day, with a good slide of that feces, not constipation. And there has to have a feeling of complete evacuation of the stool. That is the good bowel movement. Constipation, on the other hand, is the inability to move your bowels regularly, or an incomplete sense of incomplete evacuation. Very important. So we talk about the butyrate that protects the gut barrier, and also it's an anti-inflammatory, and it promotes metabolic health, meaning it promotes insulin sensitivity for the degradation of, or the consumption of, glucose. Where are the sources of this fiber? Resistant starch. How do you make a resistant starch? If you have a good rice, or if you have a good grain, it matters. You make it cool, you steam, and then you cool down overnight. That transforms into a complex carbohydrates with starch. Legumes, for example, oats, but it has to be the fiber, the hard oats, but not the instant type of oats. Second on the list is propionate. This is the second short-chain fatty acid we're going to discuss. It is very important. It's a product of metabolism or fermentation of the bacteria on the greens of the fiber. It is necessary for the liver metabolism. It affects cholesterol regulation. So it's not the effect of the green in itself that decreases cholesterol, but it triggers cascade of pathways through the propionate that will regulate your cholesterol. So it makes sense: less sugar, more carbohydrates, less cholesterol. Less sugar, less triglyceride, less small LDL, less inflammation, less sympathetic tone. Where do you find them? Oats, barley, vegetables. In general, all vegetables, whether it's green or orange, as long as there's fiber. Don't forget the source of inulin, the artichoke, that we're going to enjoy the drink of the artichoke tea. The third is acetate. It's a peripheral energy. What do you mean by this? It actually is necessary for the fat metabolism. So the greens in itself, the vegetables, is not just to improve or suppress the satiety by enlarging or expanding the stomach, because that also stimulates the production of leptin to suppress the appetite centrally, but in itself, acetate regulates appetite. In essence, it is an important part of handling your weight. You cannot just inject peptides and not eat vegetables, because the peptide in itself activates signaling. It promotes appetite, for example, or Monjaro, the one we're using this, is to suppress the appetite in the hypothalamus, the central part of appetite stimulation. Second, it delays the emptying of the stomach so that you feel full all the time. Third is to improve insulin sensitivity such that the glucose is driven into the cell and used up instead of hanging out in the serum. And fourth, it promotes lipolysis, which is the part of the breakdown product of the fat into a new energy. So that is a short chain fatty acid, which is produced only if you have fiber in your colon and fermented, or in your intestine and fermented by the bacteria. Does it matter in terms of what bacteria? There are some specific bacteria that have specific properties, beneficial properties. But in itself, in general, remember there are trillions of bacteria in a microbiota. Hello, Gerard 8797. I remember you're in Corpus Christi, Texas. Is that my wife can't use the restroom for days, which is constipation. This is exactly what I was talking about. A good dose of your probiome, which we ferment here in our clinic, of different bacteria, but you have to put two things: fiber in your diet and hydration, because you need also to hydrate the stools to get going. So I hope that answers the question. Back again to the short chain fatty acids. This is a very important benefit of the balance of the microbiome and the greens of the vegetables. The greens in itself has a special character, special benefits. Number one, carotenoids. And you see this in the yellows, the carrots, for example, or the red squash. We love red squash in the Philippines. It makes some good soup. It's good for the eye health. It's an antioxidant. We always talk about antioxidant, which means antioxidant means it counteracts the reactive oxygen species that usually happens when you're stressed. And who does not have stress? Physical stress, sleep deprivation, mental anguish, or daily worries, that creates reactive oxygen species that needs to be neutralized by antioxidants, especially the carotenoids. Of course, it lowers the risk of cardiovascular disease, heart attack, and immune support. That's carotenoids. And that includes lutein, zeaxanthin, and beta carotene. What about these flavonoids that's in the vegetables? They're a type of polyphenol found in fruits and vegetables. The fruit has to be fiber. And legumes includes quercetin. This is one. And which one is rich in quercetin? Onions. That's why onion soup is good. And don't just throw away the onions, you eat them. Camphorol and catechins. These are very important flavonoids. What is the benefit, or what are the benefits? Anti-inflammatory. It reduces chronic inflammation that's linked even to heart disease, diabetes, and Alzheimer's. Cardiovascular protection. It improves the integrity of the blood vessel so that it becomes more pliable and not thick and stiff. So it improves your blood pressure, together with other things like sauna, meditation, especially unconditional love meditation of Christ. It is very therapeutic. It has antioxidant property, as I said, reacts to the reactive oxygen species and protects the cells, especially in the mitochondria, for oxidative damage. The mitochondria in itself at the cell level can be destroyed such that it can also be unhealthy and promotes the formation of bad proteins, badly fold proteins, and that proteins can dictate the formation of cancer cells. So you need antioxidants to keep yourself free from cancer. Neuroprotection, it is well defined now. To prevent Alzheimer's, we have to have a lot of things. It's not just pharmacology, not just pharma protection. For the most important thing with neuro protection is number one, meditation, guided breathing, well known, studied. Antioxidants like the vegetables and fruits, and activity. We have talked about this. Regular exercise, aerobic exercise of 60 to 80% of the maximum heart rate for 40 minutes has shown to decrease cognitive decline and improve memory function. How do you achieve this? This is by computing 220 minus age, and that's your maximum heart rate. Let's, for example, 220 minus 60, that's about 130 something. No, 150. 80% of that is about 130. Heart rate has to go up to 130. If you go down by 60%, that's about 90 to 130. That's a good range. The most important thing to know is that you have to move. What about the third types of the substance in the vegetables? Glucosinolates. These are sulfur-containing compounds, mainly in the cruciferous vegetables. And what are they? The broccoli, the cauliflower, kale, cabbage, Brussels sprouts. So it helps in detoxification. When you're given a box of detox material from a nutraceuticals or the vitamin store, we're talking about fiber and also detox to the liver, for example. We're talking about artichokes, flavonoids. You don't need to have a fancy box full. You can get it from your garden if you're busy planting. Moringa, for example, you can plant outside. You make a moringa tea plus clove that will affect rejuvenation of the leak of the gut that's leaking or having intestinal permeability, because it is filled with these glucosinolates and phytonutrients. It has an anti-inflammatory effect, especially for chronic inflammation. Many patients manifest with non-specific signs and symptoms of inflammation. It could be just my knuckles are stiff, or it's difficult to get up. And another thing would be fatigue, the most important thing. Fatigue is a manifestation of inflammation because it's inflamed in the brain. Your brain is pretty much clogged up. The mitochondria of the neurons are clogged up, such that it's not able to produce ATP to produce energy for the brain. So you need to detoxify your brain by, number one, removing the sympathetic tone, usually from social media. Constant stimulus, increase exposure to bad news, or daily thinking, worrying about something, that decreases your heart rate variability, that is equivalent to increased sympathetic activity that leads to inflammation. Inflammation leads to cortisol increase. Cortisol increase goes to increased sugar. Sugar increases inflammation. Cancer protection. These cruciferous vegetables, broccoli, cabbage, Brussels sprouts, has been found to produce sulforaphane, a breakdown product that may reduce certain cancers. Anti-inflammatory effect, we talk about this. What about the beta carotene? It is a type of carotenoid that is precursor of vitamin A, found in carrots, sweet potatoes, not white, spinach, and kale. So if you have all these mixtures of vegetables, you provide daily at least 2 cups of vegetables 2 times a day. This will feed the microbiome. The microbiome would change this into the three short chain fatty acids that we talk about, which are the butyrate that will heal the leaky gut or intestinal permeability, the acetate that's needed for the metabolism of cholesterol, and the propionate. In summary, carotenoids, flavonoids, carotenoids from kale, spinach, and broccoli, good for the eye health. Flavonoids, the quercetin, which is from the onions, kale, apples, tea, especially green tea. We talk about any tea, green tea, you put a clove, which improves mucin production. And why is this important? Especially if you have allergic rhinitis or any propensity to viral infection. The mucin layer in your nose is there to protect you from the entry of these allergens and also the virus. Get clove, powdered clove, put it in the moringa tea or artichoke. Glucosinolates, broccoli, Brussels sprouts, cabbage. It helps detoxification, anti-cancer, and anti-inflammatory. And as I just said recently, the beta carotenes, sweet potatoes, carrots, source of vitamin A. So what are we all talking about here? We are promoting the health of the microbiome. We all have stress in life since childhood. Imagine if you have taken one episode of antibiotic or a course of antibiotics. It's almost like an atomic bomb that denuded the population of the microbacteria like Hiroshima. It will take time for that to rejuvenate. First would be seeding. And we're trying to do is the high count colony farming unit of the medical yogurt that we're promoting. And in the same token, we want them not to be killed. What are the number one killers of these? Sugar, sedentary activity, common medications like Advil, naproxen, NSAIDs, antibiotics, chemotherapeutic agents for cancer cells or for cancer therapy, and many more. These should be avoided. Avoid sugar. How do we propagate this more? By seeding, putting vegetables, which is really part of the whole dietary plan that is being introduced. And meditation. Meditation helps. It's been proven. Just simple guided breathing. 4, inhale. Hold 4, exhale 6, hold 4. If you do this 20 counts daily, twice a day minimum, and if you do it more, 4 times a day, especially for those with hypertension and all those chronic disease, it really is beneficial to the patient. Exercise. Exercise helps attenuate good bacteria. The good bacteria that would help ferment the fibers to produce short-chain fatty acids. These are all related. So in essence, we have discussed the importance of green, the importance of maintaining your microbiome with all these fibers and preventing these catastrophic events like a war zone in the gut by taking antacids. Number one is really the PPI, the Protonix, Pralosex. It is so well abused. When in fact, my first patient in Valparaiso, he wanted to write me up. He said, I'm healthy, no high blood pressure. My only symptom is acid symptoms, sometimes bloating. And he said, you have leaky gut, you have dysbiosis. So what do I do? Well, remove your Pepsid and use this gut protocol that I use, the supplements to heal the gut and also the probiotics. Together with that and the fiber, after 2 weeks, he came back and said, can I write you up? Because my symptoms have improved or resolved. And it's repeated all the time. The paradox here is that when a patient presents with dyspepsia meaning non-specific GI symptoms, bloating, acid symptoms, the gut reaction or the reflex reaction of the primary of the what do you call this of the healthcare provider is usually to put antacids. Well, it's counterproductive because that antacid can actually decrease the population of the good bacteria. And the worst thing would be if you're getting some pains and then you get aspirin, NSAID, then you put antacids like Protonix, Prilosec. It's a revolving door. Never get trapped. You'll never get out of that trap. So go back to where the nature comes from. I think we have to go back to the Garden of Eden where you can eat whole fruit. No apples except for and the vegetables. And sometimes you just have to encourage yourself to get dirty because ultra clean hands cannot really help in the repopulation of the microbiome. That is the reason why normal vaginal delivery is one of the process of nature. For the microbiome from the vagina of the as the fetus is delivered to the world, will imbibe some microbiome and seed ferment inside his womb. Nature takes care of himself. If we destroy nature, definitely it will get back to us. So with that, how can we improve our health? It really is a matter of going through the walks of nature. My niece in Australia, Les Dominguez, is giving me love. So make sure you give fiber to Gus, give probiotics, give yogurt, not the sugary yogurt, but something like the Greek yogurt, at least if you're not fermenting well. Teach them how to meditate, the guided breathing. Let him breathe in, breathe out, and that boy will be more calm. Teach them how to eat, not to eat sugar, because sugar is the enemy. Now Australia, I'm sorry, she's in Germany now, I forgot. Man, I'm getting old. She keeps on inviting me to go to Germany. But this is the key. Health is wealth, but it's always in the nature. So happy green. It's St. Patrick's Day in Cadenza. We're going to celebrate. And we'll start with a mead, artichokes. What else do we have? Roast pork and moringa, and also the, what do you call this? Wendy prepared some very special combination salad of quinoa and greens. So stay put. Till next time, thank you very much for watching. Do you have any questions at this point? I think I should throw the question to maybe Les from Germany or JRod 8797. We will give you a few minutes to give us while we are entertaining questions from here. Any questions?
I had a question. You said 2 bowels a day is normal. Like, do you recommend Miralax, Colax, Purinilax,
Okay.
any of that to help?
So here, to understand bowel movements, it takes 3. One is fiber, to allow bulk for the stools to flow, slide. We call it to slide. The fiber has to be hydrated. That's why you have to drink fluid. The colon has to move. That's why you have to do exercises. That's why in the previous encounter, we said something about do some movement like squats. It goes 2 ways. It strengthens your legs to prevent gait imbalance and fall injury. And also it stimulates the nerves to produce to the nervous system in the pelvic area to propel the colon to start moving. So 3.
So is Miralax just as bad as Advil? Like,
No, Miralax is a fiber.
Okay.
So it's okay. But why would you buy fiber, which is desiccated, when you can eat something really nutritious, like vegetables or whole fruit?
And why is Advil so bad?
Advil is bad.
Why?
3 times to the 10th power. Because eventually the mechanism is it can produce gastric and duodenal ulcer. They can bleed. They can bleed.
How? Because it
Because it prevents the prostaglandin Prostaglandin in the stomach is protective, so it inhibits prostaglandin, number one. Number two, Advil in two mechanisms can cause kidney damage. Never in my life have I actually prescribed Advil in my hospital work or even my outpatient. It's mind-boggling that nowadays nurses in the hospital would, oh, can I have Advil? Yeah, you take your Advil and you can get kidney damage. One would be it can cause acute interstitial nephritis, which is a form of acute allergic reaction in the kidney. Number two, for the same mechanism of prostaglandin, it vasoconstricts the blood vessels going to the kidney. So it essentially clamps the blood supply of the nephron, the single nephron. And if you do that every day, kill one kidney a day, it accumulates, then becomes chronic kidney disease, and eventually you lose 75%, 85%, and you'll have 15% kidney function, and that's how you get into dialysis.
What should they take instead? Because I know some
Safely, you can have, it depends on the cost. You can do stretching exercise, massage, that's the best way to do it. Anti-inflammatory, like turmeric. Do stretching, massage for wherever parts of the body, but don't just pop a pill. Investigate where it's coming from. Yes.
I was told that mineral oil, a tablespoon of mineral oil, also helps with.
Yeah, the bowel movements, any oil for that matter. But if between mineral oil or anything oil, I would prefer extra virgin olive oil, 4 tablespoons daily, because that will improve your inflammation. That's been well studied. Heart attack patients and stroke, measure the inflammatory markers, 4 tablespoons of extra virgin olive oil. After a few weeks, that marker goes down and their propensity or the risk for cardiovascular attack or stroke is diminished. And it's tasty too. Well,
Regarding fiber, say eating an apple versus like applesauce, if you're pulverizing vegetables or like
yes.
blending in
The
soup,
question is,
you're getting the same amount of fiber.
yes, as long as you don't remove the fiber by juicing it, then you're fine. If you're blenderizing the apple or the kale, you still have the fiber intact, really.
with the skin or without the skin?
I would remove the skin because you'll never know what the skin is coming from, whether it dipped into somewhere. I scrape it. If you are growing those apples, then that's fine. Yes, Ruby.
What's a good way to wash vegetables and fruit at home?
They said vinegar and some water, not detergent.
Half and half.
Yeah.
vinegar, half water,
Yes.
And just soak it
Yeah.
for 2 minutes.
And the most important thing is just to remove the pesticides and all the stuff. Forget about the bacteria. Those bacteria that you eat from the fruits are actually good. It helps you. Any other questions? Any other questions from Leslie from Germany? Just say hello. And maybe J. Rudd 8797 from Texas. Okay, I think they probably have gone. So we will officially end, and we are going to celebrate St. Patrick's Day in Ave Maria. Have a good day. Thank you.
About onions.